Welcome back to Rural Health News, the segment of Rural Health Today, where we fill you in on the latest in healthcare headlines. Today, we're bringing you a special episode. Last week, I had the opportunity to testify before the Michigan Senate Health Policy Committee about the impact of Medicaid cuts on our rural hospitals. The message was well received and followed by several questions posed by members of the committee. But for this episode, we want to feature on the main parts of our testimony.
Next, I will invite up Adam Carlson, the Senior Vice President of Advocacy for the Michigan Health and Hospital Association, and with him, Jeremiah Hodshire, who is the President and CEO of Hillsdale Hospital. Thank you very much for being here today, and please begin when you're ready.
Thank you, Mr. Chair, members of the committee. Thanks for inviting myself and my hospital colleague here from Hillsdale. My name is Adam Carlson, Senior Vice President of Advocacy for the Michigan Health and Hospital Association. The MHA represents all 129 acute care hospitals in the state. Those are the hospitals that are open 24/7, 365 to care for the patients in your communities, regardless of insurance type or ability to pay. The ones caring for your loved ones, your neighbors, your friends, and community members. According to the Congressional Budget Office, the reconciliation package passed by the U.S. House will lead to more than 10.9 million people losing their health insurance coverage. The department did a great job outlining the other financial ramifications to the state, but I think we can all agree that this bill goes beyond anyone's reasonable definition of waste, fraud, and abuse. These changes will lead to real impacts on patients as well as hospitals and providers. And I appreciated the comments on birthing services because Medicaid is the single largest payer for maternity care in the state of Michigan. And when a hospital has to make a difficult decision to no longer be able to offer birthing services because of potential cuts, that impacts everyone in a community, not just those who access their health insurance through Medicaid. With that, I want to turn this over to JJ Hodshire to share a little bit more about the local impact on Hillsdale specifically.
Appreciate the opportunity to be here, Chairman Hertel and committee members. Thank you for allowing me the opportunity to address the committee today on the uncertainty of Medicaid and the program's sustainability. I am Jeremiah Hodshire, President and Chief Executive Officer of Hillsdale Hospital, where I've served for the past 15 years. I'd like to give a brief overview of our hospital and where we're positioned today. We're an independent, non-for-profit hospital, and we have been in operation for over 109 years. It was started by Doctors T.J. Midgley and his wife, an RN, who came to Hillsdale with a passion and a vision for creating a healthcare system in which community members could receive care. Since its inception, all of our acute care hospitals provided exceptional service to those in need in our community, irrespective of their ability to pay. We have transitioned from a very small, simple payer system back in the day of bringing in canned goods to pay for services to a very complex payer system right now in our rural communities. Like mine, our community finds a gap. And that gap is fulfilled in the much needed Medicaid program and the coverage to payments of hospitals just like mine and to providers just like ours. Now, you could only expect that in 109 years, we have survived many challenges in our facility. We've had fires, we've had floods, tornadoes, stock market crashes, the pandemic, and yet each time our team comes together to ensure that we can move forward stronger and ready to face the new challenges of serving a population which is mostly comprised of rural and poor community members. In fact, roughly 70% of my payer mix is the government, Medicaid and Medicare programs respectively. Now, I testify before you this afternoon with a sense of urgency and with a petition for us to lift our voices collectively to ensure that these deep and dangerous cuts to patients, hospitals, providers, and communities is minimized. Our hospital story is no different than communities across this nation. The loss of healthcare services and hospital closures is not just impacting Medicaid patients. When the hospital closes, it impacts all patients. Commercial insurance, Medicaid, no insured, everyone suffers. Today, I want to highlight the faces of Medicaid. We have launched a series of personal testimonials demonstrating the positive healthcare outcomes associated with those who receive Medicaid and who have been unable to cope. Perhaps it was a mental illness. Perhaps it was a chronic illness children, homebound seniors, chronic illnesses, and everything in between. This program saves lives every day, right here in Michigan, in our communities. Whatever it is, we are serving the gap in our respective communities. Now, we can often reflect upon a word that was used in a presidential campaign back in the 1970s. We can refer to that as the Ronald Reagan quote, description of welfare queens, collecting state benefits, providing for and obtaining free money and benefits without a contribution. However, the faces today are those we have in our own family, those we go to church with. It's our farmers, our grocery store clerks, it's our pastors, and it's the neighbors we see in our community every day that we're involved. Let's not forget the seniors who rely on Medicaid as a supplement to their Medicare program, and prescriptions that are affordable. Office visits are manageable, and they can get the health care that they need. It is a safety net healthcare program that aided me and my family of 7 growing up in rural Hillsdale County, the very program that now finds itself in the crosshairs. One community member who relies on Medicaid to ensure her sister is living comfortably and receiving the care that she needs in an assisted living home made a very poignant statement. She lamented it shouldn't be a Republican thing or a Democrat thing to care about each other. It should just be part of humanity. According to the Nonpartisan Congressional Budget Office, early estimates that there's approximately 10.3 million people that could lose their Medicaid coverage if this bill becomes law. This is not fear-mongering or peddling inaccurate information. This is what budget and policy experts in Washington, D.C., and beyond are saying will be the impact of this legislation. This is why we are concerned today. Notwithstanding the medical devastation and the deprivation in care deserts and the lack of access to care, local economies across the country, and specifically here in Michigan, will be devastated. Our community hospitals typically represent the largest employer base in the regions. For example, Hillsdale Hospital, 2nd largest in the city of Hillsdale, 3rd largest in the county of Hillsdale. Our national podcast, Rural Health Today, we hear the exact same story from Texas to Nevada about how they're serving their local communities, how they're bolstering the local economy, how they employ hundreds of people who buy their cars and their groceries locally and build talent pipelines to support our community's future. Let's not forget the collective millions of dollars contributed back by means of community benefit from these hospitals. We help supply our food pantries, support countywide economic development, bolster community events, host blood drives, vaccine clinics, and the list goes on and on. To say that hospitals and providers are gaming the system is a direct insult and an inaccurate and dishonest representation of what we are truly doing and attempting to achieve. During numerous press conferences and congressional hearings, we continue to hear that the $880 billion reduction to the Energy and Commerce Committee budget will target fraud and abuse and somehow create a stronger America. During the same period, we have heard President Trump say, don't touch Medicaid. And as such, I'll stand firm with President Trump on that. Don't touch Medicaid. On the surface, this sounds very noble, valiant, and almost a defense of healthcare for those who need it the most. However, underneath the surface, what is not being discussed is negatively impacting hospitals like ours. It's in the proposed cuts in this legislation, as Medicaid has definitely been touched. Let's not forget that the new statewide polling conducted by Epic MRA demonstrated that 82% of Michigan residents oppose cutting Medicaid. They oppose it. Nationally, an ICYMI poll revealed that 70% of voters oppose Medicaid cuts. Where fraud, waste, and abuse exist, I think we all can agree that we need to deploy the extent and the full extent of law, including criminal or civil penalties, to address those offenders that are violating any type of law. But we cannot do this on the backs of those who need coverage the most. However, even this notion of fraud and abuse doesn't equal a fraction of a percentage of the $880 billion in cuts, and does not represent the overall will of the voter and the people in this state and in this country. Now, regarding the stereotype of a 27-year-old male sitting in his parents' basement playing video games, I want to let you know that we work very closely with Medicaid program specialists at our hospital. And we have found that when we refer individuals to seek coverage, access to healthcare is not simple and just guaranteed. Strict scrutiny over individual finances, property, assets, and subsequent verification, as well as any documentation of previous coverage, is explored before any coverage is granted. Based on my experience right here in this community, scaling back on the retroactive Medicaid payments for 3 months to 1 month for skilled nursing facilities will in fact keep many patients from obtaining much needed long-term care. Where we see these non-insured individual and patients show up, where will that be? If their primary care provider does not accept or no pay or as a form of payment, what will happen? These patients will show up in our emergency departments across the state of Michigan and across this country. We are required by EMTALA, a law, to treat every patient, and therefore cannot under any circumstance deny patients based on their inability to pay, inability of their citizenship status. So here's yet another uncompensated care at the highest cost point in healthcare, and it will shift to the individual hospitals as bad debt. It becomes my problem now. Already struggling hospitals, many with no margins, cannot sustain these major cuts that will occur as a result of this program. What types of programs would hospitals end up cutting? Obstetrics, psychiatric care, and the list goes on and on. These are core services that support the most needed services in our community. The Chartis Center for Rural Health identified that 182 rural hospitals in the United States have closed or stopped providing inpatient services since 2010. Further analysis by Chartis revealed that 46% of rural hospitals in the United States are operating in the red. 46% of us. And 432 are vulnerable to closing prior to this legislation. This is the landscape today, prior to this devastation. In this year alone, as of May 2025, 16 hospital closures and emergency department closures have already occurred. Understand one thing, this legislation will accelerate hospital closures. With the recent analysis that 20 Michigan rural hospitals are at risk of closing, and 6 of those are at immediate risk of closure. Now, some might welcome this as big systems can do a takeover or forced sales or mergers and big for-profit systems that can come in, but understand they will not receive the care that they need. Overtaxed ambulance companies who operate on shoestring budgets and reduced reimbursements will be overwhelmed with long-distance transports eating up the local resources reserved for emergencies. Receiving hospitals will be over capacity, and patients will board emergency departments for days, if not weeks, waiting for admission. The entire system will come to a grinding halt, and over time, the economic fiber of these communities, like mine, will be disintegrated. What is at stake here is that with the declining commitment and enrollments, reduced payment models to providers and revocation of much needed programs, divesting of these services will be what shutters the doors of our hospitals. This is not sustainable. We cannot do this. We cannot get paid less than the cost of delivering the service that we're delivering. We're not talking today about nurse wages and the difficulty of nurse recruitment or physician deserts and areas and communities where we can't even recruit primary care physicians to come into the community. This will only be intensified by this type of legislation. So what happens next? I say we must find solutions without delivering these cuts on the backs of our patients, and more specifically, on the backs of struggling healthcare systems and independent provider practices who will be forced to shutter their services. I do not believe also that Michigan can sustain a $1 billion shift from the federal Medicaid program to fund Medicaid at its current level in the state of Michigan. In order to cover even a fraction of this, states like ours will either be forced to increase individual or business taxes, that's not popular, or will be forced to deny access and assistance to local community hospitals like mine and health systems. And it is here at this moment where we will witness the biggest impact on the health and wellness of our communities. They will deteriorate. I appreciate the opportunity to be here today to present our story, and I look forward to any comments or questions that you may have for me. Thank you.
Thank you very much. I appreciate your candid comments and talking about the direct impact that this will have.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.